Okay, so thank you for joining us for the International Workshop in Medical Education. And this workshop is co-chaired by Ashwin as well, who would join us in a few minutes. And it's a project co-designed by the Research Committee and the SIO Global Task Force. And we would like to see and hear presentations from all over the world regarding medical education projects. And I hope that this would be a nice base to a mutual work in the future between our two committee task force in order to enrich medical education. And I must say, as an ambassador of the SIO to Europe and the Middle East, and connected with the other ambassadors that we have, that medical education is one of the leading themes that people expect us to develop and maybe even go into accreditation somehow. Or so this is highly important because many people did and are doing a lot of fabulous projects in medical education. I'm trying to push hard. I'm Israeli, you know. Yeah, okay. So the presenters include Ricardo Gelman and Gunver Kinle. Ricardo is from Brazil, Gunver from Germany. They collaborate together, as you would see. Jianping Liu and Ming Yang from Beijing, China. Catherine Wood and Johanna Hook from Sweden will join us in pre-recording sessions. Most of the presentations are pre-recorded, but we have the privilege that some people are here. And Hossam Yu is here, fortunately. Orit Gressel is here from Israel. Professor Yu is from South Korea, as you may know. Orit Gressel is from Israel, and she would collaborate with Thomas Breitkurz from Germany. Philip is here from Kenya. Ramanoir will present from far away from India. And it goes up. The first presentation of Gunver Kinle, prepared by Gunver Kinle and Ricardo Gelman, and that's about cross-cultural challenges in translating a MOOC course on traditional herbal medicine in supportive cancer care, and insights from Germany and Brazil. Gunver Kinle is from the University of Freiburg, and Dr. Ricardo Gelman is our SIO ambassador to Brazil.
Good morning to everybody. I'm very happy to be with you, at least electronically. I want to tell you about the experience of the students translating the 61 videos. So we asked them several questions and I grouped them together. What is the benefit for the students to see the videos and also to translate them? They said it's learning about integrative medicine, about other medical cultures, about history of other medical cultures, about indication advantages and challenges. It even informs their practical use at home, like remedies, but also the delicious recipes. They said, I did not know it. Now it plays a bigger role. My intention is to later work integratively with different disciplines in a patient-centered way. The videos clarified my intentions and gave orientation. And they also discussed it with friends and students to revise prejudice and to gain knowledge. The medical students, they were in the first 2 years. They said that the benefit for medical care of these videos lie in that they raise awareness of the medical staff to the needs of patients, inform students, medical staff, patients in public, to distribute flyers on course, but also on the Coursera platform, to speak about it, to send info mails, use social media, posters in clinics and practices, and also links to medical school and educational organizations. And they also stressed the point that these courses are also important for patients. So this is what I wanted to show you. And I wish you a wonderful conference, and I send you my best greetings from Freiburg in Germany. And I also want to thank very much the students that helped us to translate the video. Bye-bye.
I hope that Gunvor is listening. I can't see the people that participate online, but I've seen that it's quite a number of people. So Gunvor introduced us to the concept of MOOC, a MOOC that is shared by Coursera, the platform of Coursera, and our Technion Institute of Technology in Israel. That's where our Faculty of Medicine is based. And this was a huge project of translation, this MOOC, which includes 60 videos and 27 interviews, including with Massimo Bonucci. And the course is about traditional herbal medicine in supportive cancer care. And the project Gunvor described is a translation project of subtitles in German. And a similar project was with Ricardo in Brazil to translate it to Portuguese. And now this course is available in these countries as well. Although it's in English, it's not easy, you know, to people that are in various countries to learn this course just by listening to the English, although it has subtitles in English as well. So it was a very profound project with medical students. And what Gunvor presented is the insights of her students who really did the work with Gunvor as much as Ricardo did it with his group in Brazil. So let us move. I understand, I thought that Ricardo's presentation is weaved inside, but let us move to the next presenters in China. Morgan, can you play Jiangping Liu? And Jiangping Liu and Ming Yang are physicians who are very active in Beijing. I had the privilege to visit them and to see the amazing structure of medical education in their university, the Beijing University of Chinese Medicine and Pharmacology. Professor Jiangping Liu is one of the leaders in integrative medicine, very active, former president of ISCMAR. And Dr. Ming Yang is more into integrative oncology practice. They are highly interested in collaboration with the SIO, and especially with formats or different formats of medical education, which would be internationally based. They are very strong in TCM, but acknowledge those areas in integrative oncology, which are quite afar of what they do in ordinary life in China. So although they are leaders in China in medical education, there are a lot of other universities, of course. It's bigger than Israel.
Hello, everyone. Welcome.
Okay, let us try to see the presentation and listen at the same time. Anyhow, this is another seed for international collaboration involving the SIO. So they would present some of their goals, achievements, questions regarding collaboration with us. So the title here is Weaving an Integrative Oncology Syllabus in Traditional Chinese Medicine Medical Education from Pre to Postgraduate and Residency Programs. Thank you.
To our workshop, Challenges in Integrative Oncology, Medical Education, International Perspectives. I'm Ming Yang from the Third Affiliated Hospital, Beijing University of Chinese Medicine. I will share their experiences in China. Professor Jianping Liu from Center for Evidence-Based Chinese Medicine, Beijing University of Chinese Medicine, will participate in the question and answer session. The topic is Weaving an Integrative Oncology Syllabus in Traditional Chinese Medicine Medical Education from pre to postgraduate and residency programs. The main content will cover the context of policies of integrative medicine and integrative oncology practice in China, the medical education for Chinese medicine students and clinicians, the undergraduate integrative oncology education, postgraduate integrative oncology education, including standardized training for traditional Chinese medicine residents for master degree students, and specialist training for medical doctor. And the last one is continuous medical education, also called CME. Chinese medicine has a long history. Following the spread of Western medicine in China from the mid-Qing dynasty, some TCM experts began to explore ways to absorb the essence of Western medicine for a combination of traditional Chinese medicine with Western medicine. Since the founding of the People's Republic of China in 1949, the Chinese government has set great store by TCM and rendered vigorous support to its development. TCM and Western medicine have their different strengths. They work together in China to protect people from disease and improve public health. This has turned out to be one of the important features and notable strength of medicine with Chinese characteristics. The basic principles and main measures envisioned to develop TCM include equal attention to TCM and Western medicine, and making TCM and Western medicine complementary to each other and letting each other play to its strength. The state encourages exchanges between TCM and Western medicine and creates opportunities for Western medical practitioners to learn from their TCM counterparts. Modern medicine courses are offered at TCM colleges and universities to strengthen the cultivation of doctors who have a good knowledge of both TCM and Western medicine. There are three systems of hospitals in China. They are Western Medicine Hospital, Chinese Medicine Hospital, and Integrative Medicine Hospital. Chinese Medicine Hospital is similar to Integrative Medicine Hospital. The percentage of Western medicine service is higher in Integrative Medicine Hospital. These three types of hospitals have different medical modality. In Western Medicine Hospital, the inpatients can receive herbal medicine or non-pharmacological therapy after consultation. The outpatients may receive Chinese patent medicine prescribed by Western medicine doctors after traditional Chinese medicine training. Depends on the equipment. Not all Chinese medicine hospital and integrative medicine hospital provides radiotherapy, but patients there can receive integrative oncology care. As a result, the clinical practice of integrative oncology requires us to cultivate oncology specialists with integrative medicine. During the medical education for Chinese medicine students and clinicians, the majority of students will experience 11 years study totally. students become a qualified traditional Chinese medicine clinician after 5 years study with bachelor degree. The professional or academic postgraduate degrees need 3 years, and medical degree or PhD need 3 years. The undergrad students have courses and internship for the 5 years. In the first to third year, they take courses on TCM and advanced medicine for basic knowledge, including basic Chinese medicine theory, diagnostic of Chinese medicine, Chinese materia medica, human anatomy, biochemistry, physiology, etc. In fourth to fifth year, students take courses like internal medicine of integrative Chinese and advanced medicine, integrative oncology, evidence-based Chinese medicine, and so on. The content of integrative Chinese and advanced medicine oncology includes understandings of cancer in traditional Chinese and advanced medicine, carcinogenic factors, efficacy evaluation criteria, common complications and management of tumors, risk factors and prevention of cancers, and the treatment of different cancers. After the courses, they have 1 year as an intern and 1 month in the Department of Integrative Oncology. During the undergraduate integrative oncology education, teachers try to integrate evidence-based medicine into classroom teaching, help students know better of the concept and research method of evidence-based medicine. In clinical teaching, we have the PBL training. Students resolve the clinical problems through the evidence searching and assessment of the evidence under the guidance of teachers, and make clinical decisions based on their findings. In the medical practice, students can experience the importance of evidence-based medicine knowledge and consciously solve the problems encountered in clinical practice through evidence-based medicine knowledge. For the professional type of the postgraduate integrative oncology education, students need to accomplish the 4-in-1 study. It contains lessons for internal medicine of traditional Chinese medicine or integrative medicine, standardized training of TCM resident physicians, graduation certificate, and degree certificate. In the standardized training for traditional Chinese medicine residents, there are 4 components, including theory learning, clinical practice, learning from teacher, and methodology part. Residents learn the Chinese medicine theory, syndrome differentiation, the classic of TCM through self-learning and lectures. They will have 24-month internship in internal medicine of TCM, surgery of TCM, gynecology of TCM, pediatrics of TCM, acupuncture and massage, and orthopedics of TCM, and 9 months for specialty training, for example, in oncology department. They also need to learn from teacher of how to diagnose and give treatment according to TCM theory in the clinic half day a week, and grasp the methodology courses. In the methodology learning, residents have 72 hours of lectures on clinical practice methodology. It has 2 parts, clinical epidemiology and medical statistics. Teachers introduce the basic concept and study design for different research types and primary medical statistics. Residents need to accomplish the RCT design and the cross-sectional study design as group tasks. The aim of standardized training for TCM residents in oncology department is to master the professional theory, professional knowledge, and technical skills related to common diseases in TCM oncology department. It can last 1 month at least, or 9 months for oncology specialty students. In the oncology department, residents will learn the etiology and the pathogenesis of tumors, the principles of treatment, the commonly used therapies and drugs of TCM, the characteristics and advantages of TCM on cancer care. The cancer types include lung cancer, colorectal cancer, stomach cancer, esophagus cancer, liver cancer, pancreatic cancer, breast cancer, ovarian cancer, etc. The medical doctors have specialist training. It aims to cultivate comprehensive talent. Based on the TCM theory, the students need clinical diagnosis and treatment ability of traditional Chinese medicine and Western medicine, multidisciplinary comprehensive application ability, and scientific research innovation ability. The continuous medical education is also a main component in the learning after college and university study. All registered medical practitioners are required to complete CME training each year. Different courses are offered online and including integrated oncology courses without doubt. Last month, SIO in China, CSIO, invited experts and gave speeches on integrative oncology, and the lectures were very impressive for integrative oncology doctors in China. To make a summary, China has a long history and culture for integrative medicine, and the policies are very supportive. In the context of integrative medicine, Western medicine doctors learn Chinese medicine and vice versa, especially in integrative oncology area. And in recent years, evidence-based medicine is integrated into integrative oncology learning at different stages, and it improves the level of integrative oncology education. That's all for the presentation on integrative oncology syllabus in TCM medical education in China. Thank you for your attention.
Good morning, everyone. We'd also like to welcome the 36 attendees that we have participating online. And next we will hear from Dr. Catherine Wood and Dr. Joanna Hock from Sweden. And their presentation is entitled Co-Designing Online Integrative Oncology Training in Sweden, Multidisciplinary Collaboration of Oncologists and Pharmacists in the Context of Medical Education. And please cue the next presentation.
Hi,
Thank you.
everyone. First of all, I want to thank Aaron and invitation to participate in this workshop today. My name is Catherine Bode. I am an oncologist and specialist in palliative medicine and a researcher on CAM in cancer at the University of Umeå in northern Sweden. I give this lecture together with Johanna Hög Nordberg, who is a pharmacist and my fellow regional expert in integrative cancer care at the Regional Cancer Center in Stockholm, Gotland. She's also a researcher and educator at Karolinska Institute in Stockholm. At the time of this recording, Johanna is ill, so therefore I will be presenting on behalf of us both. The title of our presentation today is co-designing online integrative oncology training in Sweden, multidisciplinary collaboration of oncologists and pharmacist medical educators. First of all, I'd like to introduce some key facts about the context in which we have created this training. Sweden is a country where most people have a very high trust in secular values, such as science and research. Healthcare is provided by the government and is covered by taxes. According to the law, healthcare professionals are obliged to practice based on science and experiential knowledge. Non-licensed providers are prohibited to treat cancer. Although researchers shown an extensive use of complementary approaches among cancer patients, actually as high as in other European countries with much more liberal legislature, before 2020, no training in KIM for cancer care professionals existed. There are 6 regional cancer centers representing administrative authorities with mandate from the government to improve cancer care. As the only regional experts for integrative cancer care in Sweden, in 2020, we got the mandate to create a national online training for cancer care professionals in the whole country. Now I will tell you about the course itself. The course's title is Complementary and Integrative Medicine in the Context of Cancer. We use a digital platform developed within oncology for distance learning. The platform is easily accessible both via mobile phone, tablet, and computer. We know that healthcare professionals often want to take courses in small portions on the way home, sitting on the tube or bus, which is possible with this platform. The course's target groups are professions within cancer care, mainly doctors and nurses, but even physiotherapists, dietitians, social workers, occupational therapists, camp therapists working with cancer patients, heads of departments, expert patients, the Swedish Cancer Foundation, and others have been participating. We hold the course 2 times per year, one in autumn and one in spring. One course comprises 3 days full-time studies. 2 days are for distance learning, where participants are free to decide when to work with the course over 5 weeks. One final day is a seminar with all participants together. Most choose to participate physically, but there's even an option to participate via Zoom for those living far away from Stockholm. Main goals for the course are to get knowledge about complementary and integrative medicine in cancer, to get tools for knowledge-based dialogue in between cancer care professions and with patients, and to have knowledge about national regulation and to have trained to find information on evidence, effectiveness, and safety in trusted databases. In summary, we want clinical professions to be able to check both evidence and interactions in their everyday work and feeling more comfortable with asking questions about CAM. The course is divided into 5 modules. First, introduction. Second, national and international outlook. Third, herbal medicines and supplements. Fourth, mind-body methods. And fifth, the medical systems and the patient perspective. Within these modules, there are learning activities that include 23 recorded lectures, 2 movies as examples of the practice of integrative oncology in a Swedish setting, quizzes related to the content of the lectures, reflective writing tasks, reading selecting chapters in integrative oncology, tasks related to searching in databases, including natural medicines, 1-year subscription included in the course, and the databases about herbs from Memorial Sloan Kettering Cancer Center, camcancer.org from the NAFCAM in Norway, and National Cancer Institute's PDQs on integrative therapies. In the end of the course, we meet in real life for a full day of discussions where we also discuss the drawbacks of KIM and severe cases. I will now present the main lectures in the course and presenters. Within the national and international outlook module, I have 2 lectures, one on cancer patients' use of CAM in the context of cancer, and one on Swedish legislature. Jenian Brodin Danell from Umeå University in northern Sweden talks about research and the political debate about CAM. Meek Yong, head of the Norwegian Research Center on CAM, NAFCAM, talks about their work, including their database CAM Cancer. Yun Mao from MSK gives a lecture on integrative oncology, the MSK model. Former SIO President Linda Balneves gives international perspectives on integrative oncology, including SIO's work with guidelines. And Catherine Solman, medical director of Penny Brown in Bristol, talks about their work with both patients and supporters. In the module about herbal medicines and supplement, Johanna goes through regulation of natural products and supplements. An oncologist colleague doing research on vitamin D in palliative care, Maria Hilde Franklin, talks about vitamin D. Linda Balneves has a lecture on the evidence of cannabis in cancer. Gunber Kienle, having the possibly best overview on research in this field, talks about mistletoe evidence. And Gary Deng from MSK talks about dietary supplements and how to handle these questions in a clinical setting. In the module about mind-body methods, SIO's president Linda Carlson has a lecture on mindfulness-based interventions for coping with cancer. Dr. Holger Kramer, associate editor for the journal Complementary Therapies in Medicine, reviews yoga and cancer. Professor Alex Molasiotis from Hong Kong goes through acupuncture within cancer care. Lena Ugla from Sweden, PhD and music therapist, talks about music therapy for children and adults with cancer. And Fanny Airosa, nurse and PhD from Sweden, talks about tactile massage in healthcare. We have even produced two movies, one on tactile massage and one on medical yoga. In the last module, we take a look at the 3 big whole medical systems. John Hughes from the University of Western London talks about traditional Chinese medicine in cancer. Mark Schleppi from Switzerland talks about the practice of anthroposophic medicine. And Santosh Rao, SIO's president-elect, gives an overview over the philosophy and practice of Ayurveda in cancer. And finally, the research and expert patient Sarah Rigger from Sweden talks about expert patients as a new resource for healthcare improvement. We started our first course in spring 2021, and since then we have completed 3 full courses and have recently started the 4th round. We accept 30 to 40 participants per group. As you can see here, the participants' evaluation reveal that they have valued the course highly, with 5.0 being the best possible score. Importantly, we also see from the last 2 groups that the course seems to make a difference in participants' confidence about asking and answering questions about KIM. As you can see by the numbers here, participants feel more confident in both asking and answering questions about KIM after they have taken the course compared to before. And finally, we want to share some participants' voices. One participant said, "Very interesting and instructive. Feel that I want to look through the material again, at least, to see what I missed." Another said, "Good distribution and choice of themes, very good arrangement with lectures, reading and course literature, and discussion forums, and that was not time bound, but you could do it whenever you wanted within the course period." A third participant wrote, "What a great and important course. Will really recommend it to everyone I meet." And a fourth said, "Great, eye-opener. Great with several scientific databases to use in the clinic. regarding CAM, KIM for patients and colleagues. And the fifth participant wrote, very exciting and interesting, got the tools I was looking for. I feel much more familiar and can discuss with patients in a calmer way about CAM and KIM. Do not feel that I need to be defensive. So this is what we wanted to share with you. Thank you very much for your attention.
Next, I would like to invite in person Professor Hwa-seong Hugh, who joins us from Korea, who will be delivering a short presentation, a 6-minute presentation entitled The Korean Society of Integrative Oncology, KSOC, and its board-certified educational programs. Dr. Yu.
Which one? Yeah. Okay.
Good morning, very early morning. Today, I will talk about the Korean Society of Integrative Oncology and its board certified education program. I'm passing you from Seoul Korean Medical Hospital of Daejeon University, and I'm the director of East-West Cancer Center of the hospital. Next. It's not easy. Okay. It's the agenda of my presentation. Okay. KSIO was founded in 2015, and KSIO aims to develop and disseminate integrative oncology in Korea. And the academic conferences has been held every year since 2015 and started a board certified education program from 2019, but we issued the certification from 2021. Since our society's core value is to integrate to what we need for better cancer treatment, and we do need both side of medicine, Western and Eastern medicine. To do that, we have decided to have two presidents. So I'm a co-president of Korea, KSIO, for the Eastern Asian medicine, traditional medicine. And Dr. Ki is a co-president for Western medical medicine. And we also have a chancellor, Dr. Jin-Mo Kim. The total number of KSIO is 758. Associate member is 617, and regular member is 125. Board member is 29. And membership of the society includes medical doctor, Korean doctor, integrative oncology health professionals who are interested in and want to contribute to the development of integrative oncology in Korea. And we already have translated these two books, Integrative Oncology and by Donald Abrams and Anti-Cancer Living by Lawrence Cohen, because we believe they would be useful in the study of integrative oncology in Korea. And these books became to the background of our medical educational program. We has held the annual conferences from 2015 biannually. For example, the topic is integrative oncology in Korea, new horizon of integrative oncology in Korea, China, and Japan, and cancer immunotherapy and integrative oncology, etc. And we have covered various topics and showed recent research findings and clinical findings. We also have the board certification education program for medical doctor and for oncology health professionals separately. And the purpose of this education is to keep up with the most recent research findings and cancer treatment trend, and to bridge the knowledge gap that exists between Western and Korean medicine doctors when treating cancer patients. And it's the supplementary study material, including all lecture material in one book for each of you. The lectures for the health professional are focused on the general knowledge of integrative oncology, providing 21 hours lectures. And it's the topic of the education program for integrative oncology health professionals. We followed the list of the book of integrative oncology by Dr. Donald Abrams. And lectures for medical doctor include all the lectures for integrative oncology health professionals, plus recent research findings to provide more evidence-based clinical guidelines. The examination is composed of 150 questions, 50 of integrative oncology health professional examination, and additional 100 questions, and 70% or more to pass. Is the content of education program for medical doctors. And we also provide the certification like this. Examination takes place on one day, 3 hours from 9 a.m. to 12 p.m. Just an online examination, and multiple choice question, 100 questions for integrative oncology professionals, and 150 questions for medical doctor. And the certification is valid for 3 years. And last year's statistics, medical doctor 185, and integrative oncology health professionals just 19, and total 204 got the certification from our society. And these markers represent KSIO members in integrative oncology clinics, and our members and patients are introduced to the integrative oncology doctor who are part of KSIO and received the board certified education from KSIO by sharing this information on the website. And second, board certification program are currently underway. This year, the examination will take place in November, this November. And we'll continue our annual board certified education program, and we'll keep updating the lecture materials with the new research findings to educate Korean medical professionals who are in integrative oncology professions. And we will continue to envision increasingly incorporating integrative oncology practice into standard practice and improving accessibility and transforming oncology care in Korea. Thank you.
Thank you very much, Professor Yu. That was really something to see it from a national perspective, the work that you do. Our next presentation is also in person, presented by Dr. Orit Gressel on behalf of her colleague, Dr. Thomas Breitkreuz, that I hope is one of the people online. And Orit will speak about, Orit is from Israel and Dr. Breitkreuz is from Germany. And the educational dilemma here is how to educate both physicians and nurses and other healthcare professionals internationally how to work with different groups, how to train them. So the stage is yours, Orit. Thank you. Good luck with that.
Oh, so good morning. My name is Orit Gressel. I'm an integrative physician from Israel. Work mostly in Haifa in northern Israel. This presentation was supposed to be dual with Dr. Thomas Breitkutz from Germany, but I understand there's no way of him speaking, right? So I guess I will be going over his slides, skipping over them. Okay, so what I'm going to do is talk about the second and the third co-training. And I'm going to skip. Sorry, Thomas, if you see this. One moment. He was going to talk about Kim, a special project in Germany. So I'm going to start with the Israeli-German Integrative and Palliative End-of-Life Care Co-Training Program that we held in June 2016. The idea was to create a dialogue between the palliative care and the integrative care with the understanding that the treatment model should be multidisciplinary. Both aspects should be included in the same treatment. It started with these two. You can see Professor Eran Ben-Arieh, or Eran, can I do first base now? Okay, so Eran over here and Thomas, that's them in the picture. About half a year of emails going back and forth because it was kind of a problem to develop. So first we started with defining the training goals, what co-forming the curriculum, what contents to include or exclude in this program, defining inclusion and criteria for the trainees, who is going to participate, coupling the German and Israeli moderators, because you'll see later on each group had 2 moderators, assessing and reassessing the barriers and the limitations that we were going to have, and of course, funding. So in this training program, we focus on giving therapeutic tools in integrative medicine for treating the palliative patient in the end-of-life setting. And before we went to Germany, we started with a very intensive 3-day pre-training in northern Israel for the Israeli team before we left. And we heard from different lecturers, different disciplines, a mixture of palliative care practitioners and integrative care practitioners, all of them teaching us and getting us ready before we went to Germany. So June 6th, this is going to be like a story. June 6, 2016, this is a Paracelsus Clinic parking lot, 2 big vans. FYI, I was driving the one on the left. I had great fun. It was really great. We were 14 practitioners from Israel, physicians, nurses, complementary integrative medicine practitioners, spiritual care providers, all of us in these 2 vans. And the first thing we were faced with was this. The Lynn Medical Center, you can see it on the right. Yeah, on the right. This is a building, this is where we came from. A very conventional building built in the 1950s. You can see communist, whatever, yeah. On the left is the Paracelsus Clinic in southern Germany. So it was first that we had a meeting of architectures, and then we had a meeting, we had some kind of clash with the way teaching was done. I don't know if any of you have any anthroposophic medicine experience, but this is the board teaching with chalk and scribbling. So we had some adjustment there. We were 14 Israelis, 25 Germans from different hospitals. And we were set into 6 different groups, and we had color coding. We had 3 groups, Israeli groups, 3 German. We had these little stickers. We knew what we were belonged to. And Each group was, we had a medical, like an MD, nurses, practitioners, complementary practitioners, spiritual providers. This was a mixture of people. So in each group. And the idea was, because we were going to have this for 3 days, we wanted everybody to work with everybody else. So day one, the two green groups were together. Day two, we went crossing over, and day three, crossing over again. This way we got to meet everybody. It was complicated. We had different learning modalities, and we had 2 modalities every day to learn, or modules. Day one, we had gastrointestinal concerns and cancer-related fatigue. Day two, fear of death and dyspnea. Day three, we had pain and suffering. That's what we addressed. And of course, at the end, dying and across the threshold, because we were talking about end of life. And so you can see how the modules look, but each module, ooh, what did I do? Oh, okay. Each module was composed of 3 segments. The first segment, everybody was together in the same room. We had presentations. We had to know about the approaches, the research, patient-centered outlook in both anthroposophic medicine and complementary integrative medicine modalities, and also a spiritual and cultural perspective. We wanted to know from both sides. The second segment, we went out in these groups, these red, green, and blue groups, into different rooms, and we had hands-on practical workshops in really teaching each other how to work. So we were like the anthroposophic medicine team would teach the Israeli team how to work, or different practices, and vice versa. So that was the second segment. And the third segment of that module was structuring a patient-tailored approach. How would we approach the patient from the different disciplines? At the end, of course, we had a questionnaire. We had to find out how it worked. And I'll just read out 3 of the narratives. It was very moving for me to see Jews, Arabs, and Germans sitting together. I didn't say this, but our Israeli group, we had both Jews and Arabs together, because that's how we work anyway. Looking for ways to help patients live out their last days as best as possible. My belief in teamwork was strengthened, that I should be more of a partner in giving space and respect, and to sometimes transfer responsibility to another therapist. The practical elements to which we were exposed opened my eyes to the additional therapeutic tools which are available. And 1.5 years later, of course, this came out in supportive care and cancer, crossing the death threshold, experiencing multidisciplinary end-of-life integrative oncology training. And I'm going to try and see if we can get to the conclusion that, which was, of course, we understood that even before it came out, end-of-life training of complementary integrative medicine trained HCPs enhances communication and palliative clinical skills. Multidisciplinary and international training settings emphasize a cross-cultural perspective and enrich the psychosocial, spiritual model of palliative care. So that was the first training program, and it took us a few years. And then we had an international 3-day workshop, multidisciplinary training program in integrative manual therapies in palliative oncology practice, this time in Haifa. And this time you can see that Eran and Thomas are a bit more relaxed. I think even Thomas didn't have a shave that day. The primary objective of the project was to improve anthroposophic medical nurses and complementary integrative medicine practitioners with manual movement therapy related skills via a skilled-oriented training, both in anthroposophic and complementary integrative medicine manual techniques. This to help alleviate patients' unmet concerns when palliative care is suboptimal. So this time we focused on touch and movement. We were 35 participants from Israel, Germany, Italy, Cyprus, Turkey. So this was a few more countries. We had a lot of fun because we accommodated everyone in our homes. And this was really good because I still WhatsApp with Emanuela Portalupi, which might be online, I don't know. And we help each other, and still the communication is still open. We migrated in 3 different locations in Israel to make it more interesting. And this time we did not complicate everything with 3 different color coding groups mixing up. We had 3 fixed groups, and of course 2 moderators, one from Israel and one of the guests. This term, our learning modules were cancer-related fatigue on day 1, peri-procedural concerns. This included chemotherapy, surgery, diagnostic procedures, what we can do manually to help the patients going into these procedures, chemotherapy-induced neuropathy and pain, sleep-related concerns, and on day 3, loss of appetite, GI concerns, and addressing the concerns of the caregivers. Again, the modules, we had the same like we had before, with the 3 different aspects in it on every module. I'm going to show some pictures. So this is all of us sitting together in different places. You can see here 2 different, well, one is me taking care, I think, of, okay, well, on the right, you can see a compress that we were taught, an anthroposophic medical compress. We were singing together, holding hands together, doing lots of projects together. And I couldn't resist putting Thomas with his shoe off, learning liver 3 acupressure, liver 3 for those of you who are Chinese medicine practitioners. And what came out of this workshop was the European Middle Eastern Integrative Oncology Research Group in Manual Therapies. And the picture is from Donach from September of 2019. We had participants from Egypt, Jordan, Iran, Israel, Palestinian Authority, Cyprus, Turkey, Switzerland, Germany, Italy. Everybody was in. And Iran, because Thomas isn't here, do you want to add a few more words about that? Okay, so thank you. And Iran will just say a few words.
I'm honored to wear a tie from Tehran, a present from this workshop. And it's not easy to work internationally, but it is really challenging to work in the frame of the Middle East with the countries that don't have a very good relationship. They all have relationships, but not very open as we would imagine. And the idea of this 3rd project is to train physicians and nurses and other healthcare providers, psycho-oncologists, and so on, in providing manual therapies, movement therapies related to specific palliative concerns. And we have just started with a common research using a questionnaire in order to assess patients' attitudes of how integrative models should be structured in their own oncology centers all over the Middle East. So at present, we have 300 questionnaires that were filled in Egypt, in Palestine, in Jordan. They are working on it in Iran, using our questionnaires, translated to Farsi language. In Turkey, they also have translated our questionnaires. And the 2nd and 3rd stage is in launching a real workshop, in-person workshop, a 3-day workshop, maybe in Italy, maybe in Cyprus, and training those healthcare providers with the aim to launch at the third stage integrative oncology programs in each of these countries, mentored online by people who cannot actually come and train people in vivo, yeah, in that area. So thank you for that. And we would move now to another world area, and I would ask Philip to present his insights from Kenya, and later on Ramanoir from India. So please split the time between you and Ramanoir, okay? So something like 6 minutes. And what we would, the title of this presentation is The Challenge of Incorporating Traditional Medicine in Evidence-Based Integrative Oncology Training, Lessons from India and Kenya, and we would start with Kenya.
Thank you so much, Aaron, and good morning, everyone. And I know we are different countries. Do you have my slides up? So my name is Philip. I'm a clinical psycho-oncologist from Nairobi, Kenya. I just put that map because yesterday someone was asking me, are you from Nigeria? I am not from Nigeria. I am from Kenya. Nigeria is on the other far end of the country. It's very important to know that. Yeah. Gosh, this is, there you go. So a quick facts about Kenya. Kenya is a small country with a population of 54 million. And of course, cancer is one of our third leading cause of death in Kenya. And the key point to note here is that our diagnostic rate is really at late stage. 80 to 90% of cancer cases in Kenya are diagnosed at late stage. And that's really a main concern for us. So our main hospital in Nairobi or in Kenya is Kenyatta National Hospital. As you can see, it's a very old hospital. But some of the challenges that we are facing before I even moved into integrative oncology is we have major challenges in cancer care and cancer treatment in Kenya. Number one, we have the deficit of oncology workforce. We have very few oncologists for a very big population. And what we find in Kenya is that 80% of the oncologists that we have in the country are concentrated at the capital, which is Nairobi. And then of course, we have what we call weak healthcare systems. And of course, referral networks are not as developed as such. And then of course, we have protocols for treatment that have been developed in the country. But again, they're protocols, but following those protocols and enforcing the protocols sometimes is a major challenge in the country. And we've had cases of treatment abandonment among patients, sometimes because of financial issues. So of course, with these challenges that we have in the mainstream cancer care, you will note that then when it comes to integrative oncology is a different ballgame. The picture on the left, on the other side is a herbalist. So we have competing interests with herbalists, with traditional witch doctors. And as you can see, they almost show that they can heal everything. So these are some of the challenges that we are facing in the country. So the key thing then with the really trying to mainstream integrative oncology in the country is we have to change the mindset of the oncologist, because when I go in as an integrative oncologist, they are going to view me as the person who is on the other side. So really trying to change that mindset that what we are doing, number one, is evidence-based. And it's not just any hocus pocus or anything that you can do. Number two is lack of trained experts in integrative medicine. We do not have a lot of people who have been trained in that. And then of course we have lack of strong evidence-based support. And like I mentioned, this needs to start from the mainstream, from the medical team. if we are able to get buy-in from the medical team, it will be very easy then to be able to address these issues. And then, of course, one of the key, I think, main positive is that a majority of the population actually acknowledge traditional medicine. So that would be a very good entry point if we are able to, develop integrative oncology in Kenya. I know we talked about the challenges, but I always like to be an optimist. There's always the light at the end of the tunnel. And I'm putting there Africa because Kenya, what is happening in Kenya is actually the same thing that you'll find in other African countries. So when I was looking at this, I figured out there's a lot of opportunity, but then there's also that capacity for Africans, to really embrace integrative oncology. In Africa, most of us are farmers, and we'll say the soil is fertile. When the soil is fertile, it means that when we're able to plant that seed of integrative oncology, it will do very well because number one, there's the acceptability of integrative therapies in the African continent, and of course in Kenya, because it resonates very well with us. Africans are very holistic, and I think this will resonate well. And then, of course, there are policies and laws in Kenya that are actually accepting or acknowledging that traditional medicine is core and part and parcel of what we are doing in Kenya. So that becomes a very good entry point in bringing in integrative medicine. And then, of course, there are also some communal or some attachments with some of the therapies that we are doing. Yesterday, somebody was talking about drumming and how healing properties of drumming. Somebody was talking about dance therapy. These are things, music therapy. These are things that are really embedded in the core of African culture. So acceptability will be very easy for us. So then moving forward, so how then can we be able to really address the deficit, the need, the challenges? And I have 2 slides. Number one is the short term. How can we be able to bring in integrative oncology or integrative therapies in Kenya and of course Africa? And we've talked about these webinars, amazing way of really, creating awareness, because we have to start from the awareness stage. And then of course we need to organize pre-conference workshops in our oncology conferences. We have a couple usually happening in Africa. And then, of course, we also need to facilitate training. We have to start with the practitioners, because the practitioners, when we get the buy-in from the practitioners, then they'll be able to share it with the patients. And then, of course, we've also talked about identifying champions. When you identify a champion, they become boots on the ground when we are trying to integrate mainstream integrative oncology. Then, so this is one of the conferences we have in Kenya. It's in November. It's an oncology conference. We have lots of nurses, over sometimes 2,000, 3,000 nurses and doctors across Kenya coming in. So using forums such as this to be able to share about integrative medicine. And then, of course, we have the next conference that is going to happen next year in Senegal. And this is, again, a forum that brings in mostly all the oncologists and people who are in the oncology landscape. So as I end, then what are the long-term goals? It's very important for us to note that the Kenyan government, like I mentioned, really acknowledges traditional medicine as key and parcel component of our healthcare system. I think the key thing for us is really changing the mindset of people about the traditional medicine, that it's something that is evidence-based. And then, of course, working on referral systems. And then I was so happy when I noticed what the people in Japan, in Korea and China are doing, really embedding the training in the medical school. And it's my dream and my hope that at some point we'll be able to have such kind of trainings in our medical schools in Kenya, because you start from the medical schools. When you start there, the doctors, the medical practitioners have an understanding of what integrative medicine is. And then, of course, really exploring how can we be able to credential have training programs and accredit them so that people are aware about these services that are there. And then I hope some point, Aaron, that we'll be able to have, the low and middle income country SIO chapters so that we can have an opportunity to share about the challenges that we face, to share about the small things that we are doing within our limited resources. So that's it from me. We say in Africa, if you want to go fast, go alone. If you want to go far, go together. And I hope that together with the international community, we can be able to mainstream integrative oncology in Kenya and Africa. Thank you.
So next, I'd like to welcome up on stage one of our board members, Dr. Judith Lacey, who will be presenting integrative oncology training and education from a family medicine and supportive oncology perspective, insights from Australia and the UK. Judith.
Tripped up the stairs, but I actually have to say I'm absolutely freezing and I don't know how I can even function in this temperature. But now I've, but I'd love to be able to do my slides. So, and which button? The big green one? So can we go back one? Yep. So I'm going to speak for just 6 minutes and then hopefully Catherine Zolman from England, her slides work and she's recorded her slides from her perspective on family medicine. I've been asked to speak about integrative medicine in supportive oncology. I guess a little bit about me would help to understand where I'm coming from. I'm the head of supportive oncology and supportive care and integrative oncology at a large comprehensive cancer centre in Australia. It's called Chris O'Brien Lifehouse. It's one of the largest teaching in oncology hospitals in Australia and a very large research unit. But also I am very involved in the development of both integrative oncology and supportive care in that space. And now this is maybe that big green one. There are I'm there. So when I think about educating a society and a community that I'm working with and that others work with, I try to break it down into the number of groups that we're targeting in our education programs. The first is educating, and I'll come back to this, by discipline. Each of our practitioners have their own education programs in integrative oncology and integrative medicine, and experts in their field, and I will come back to that education program in a minute. We educate our patients and our carers on self-care in our programs and run various workshops to engage them in understanding lymphedema, understanding symptoms related to cancer, and understanding ways to care for themselves, as well as what opportunities we offer them. We educate by symptom management and we educate, and I'll come back to that, but we also educate our referrers, and we've just recently completed a survey of healthcare professionals, about 200 healthcare professionals, trying to work out what it is that they would like to be educated on to inform us, so that we actually design education programs in integrative oncology and supportive care, but integrative medicine specifically, that could speak to what they want to hear. So we're not educating on our agenda, we're educating according to their agenda. And we run various regular sessions for our junior hospital staff. So the importance of educating the junior doctors, not just in how to rotate opioids, but also how to refer, and the value of integrative therapies. In Heather Greenlee's, in an article she wrote a few years ago, I stole this line that implementing integrative therapies in clinical setting, it requires a coordinated team approach. and you need well-trained practitioners. And so in order to set up a service, we rely on the education programs and we participate in the education of each of our workforce members. So our oncology massage practitioner runs the oncology, is one of the teachers for the oncology massage program training for Australia, and runs up to a 4, you have to get to level 4 to be able to work within a hospital. And we're a site for that training, which means that people will come and receive their training within the integrative oncology within our unit as part of the hospital. That our acupuncture, doesn't matter, I pressed the button accidentally. Our acupuncturists have their own training and their students come and do placement with us within the hospital. The exercise physiologists will do training in our integrative medicine department and learn about integrative medicine while doing their exercise oncology training, similarly with our lymphedema therapists, similarly with medical students coming through our service. And so much of the training is very much formal training within their own centres, areas of expertise, but then practical training within our centre. And that's very much by the bedside within the clinic, shadowing the acupuncturists and shadowing the massage therapist, shadowing the reflexologists and so on. When teaching the multidisciplinary team about, I can't make that go back, can I? When teaching the multidisciplinary team about cancer care, I break it down into making sure that they're continually updated on what's going on for different cancer groups. So regular updates on breast cancer, on lung cancer treatments, on the etc. All the different groups. We have access to obviously the multidisciplinary team meetings, cancer treatment updates, and then treating and then having discussions regularly and weekly meetings discussing patients and then discussing integrative approach and the latest approach to symptom management, which is fantastic within our small group. And what we've started now is a program that will also be for our general practitioners and our broader community on each modality, educating each other on each of the modalities and how they can be utilised in the supportive oncology space, but also educating the public and so this will be an open program. And so it's always this balance of educating about assessment and educating around guidelines. So supportive oncology, and within 6 minutes, this is just a flash really to say that supportive oncology is a growing space. Integrative medicine is a very significant part of the toolbox that we provide in the supportive oncology space. So we have very purposely expanded our umbrella of supportive care and supportive oncology to include the pain specialists, the palliative care specialists, us, the integrative oncology doctors, general practitioners, geriatricians, all working together in the one multidisciplinary team with our integrative medicine practitioners in order to educate weekly through case studies, but also to have more formal education across disciplines at various conferences and regular meetings. And as a result, we're invited to present on different practices at different meetings and and different craft groups. And gradually, the aim is to become seamless, but what we are still lacking, and I'm very jealous of was it the Swedish or the Swiss, the group from Switzerland that have their education program in Sweden, that fantastic education program, and to have, if this discussion today can promote a universal education program for doctors and nurse practitioners working in this field, I think that would be a fantastic outcome, because I think that formal program, and there's so much going on in this space, is really the next step. And hopefully we'll be seeing that from SIO soon. So thank you. I'm going to now go on to Catherine's slides and just double check that they're working. And hopefully I might need to continue this. So Catherine Solman is speaking from England. She recorded her slides and sent them to me last night, and let's see if they've come through. She's from the Penny Brown Centre. She's the UK ambassador to SIO.
UK is a non-profit or charity which has been supporting people to access integrative cancer care for the last 40 years. And we offer a range of lifestyle education as well as complementary therapies, all designed to go alongside and support whatever conventional cancer treatment a patient is having. And our services are offered to any adult affected by any cancer at any stage of the journey, anywhere in the UK. And these are all offered for free, which is fantastic. But it does mean that we are outside the mainstream systems where healthcare professionals are educated and where cancer patients are treated. So if we are going to educate our healthcare professional colleagues, there's no obvious or routine way that we would come into contact with them. And so we need to be a little bit creative when we think about how we might go about educating people about the benefits and potential that we're seeing. So one of the ways that we can do this is through educating our patients and caregivers to become our best ambassadors in a way, and to teach and educate their oncology providers about the benefits that they've experienced through using our services. And over the many years, we've demonstrated through various evaluations the very positive lifestyle changes that people can make and the improvements in their cancer-related concerns and general well-being. And so we encourage all our clients and patients to be open and honest with their oncology providers about what they're doing and what they're using in terms of integrative approaches, so that they can educate their teams. And we do see that increasing numbers of healthcare professionals are pricking up their ears and are interested in inquiring and referring more patients to us and actually coming to find out and to learn more from us. But that's obviously a rather small scale and informal way of educating our professional colleagues. So what else can we do? Well, we've also taken advantage of the virtual space to organise some virtual conferences, and we've organised a patient and caregiver facing conference over the last few years, which has involved a range of global experts coming and covering many aspects of integrative oncology. And many of the speakers and global experts who we've drawn on are people who are in the audience or on the podium here at SIO, because our international colleagues have supported this wonderfully. And we've seen that we've had a very impressive take up and much interest in attending. But what's been fantastic is that, and interesting to note, is that 29% of the audience were actually healthcare professionals. And this obviously means that there is a gap in the market for professional focused education in the UK if this many healthcare professionals are attending patient facing events to get their integrative oncology education. So BSIO, or the British Society of Integrative Oncology, are keen to fill that gap, that education gap, and we've been running a series of monthly webinars on various topics in integrative oncology, again very generously supported by many of our international colleagues and friends. And we've organised a series of annual integrative oncology UK conferences, which are also online and tailored specifically for professionals. Of note has been that 37% of the delegates who attended last year's the 2022 conference were new to integrative oncology, and 20% of those worked in the NHS, which is great because it means that we are finally beginning to burst through that echo chamber where we've been for the last few years, where most attendees at integrative oncology conferences were people who were already interested and already aware of the benefits. But something that I'm even more excited about is the medical student placements that we've been running at Penny Bron for the last 5 years. And we've been partnering with the Bristol University Medical School to offer immersive experiential placements which last between 3 and 8 weeks, where students can really come and learn from and with our clients and patients and shadow them and follow them through the various courses and classes and one-to-one appointments that they can access through our centre, where they can speak directly to the patients about their experiences, both in the conventional setting and in an integrative setting, where they can learn from our multidisciplinary team. And here are some of the feedback and comments that we've had from the students after the placement. And I'm just going to read the top one because I think it really epitomizes the benefits of introducing students of healthcare to these integrative approaches at a really early stage in their training. This placement will revolutionize your outlook on medicine. It's a place of hope and optimism where people are seen as a whole, and you see integrative medicine truly empowering people in the long term. What you see will shake you emotionally, but the wisdom and fulfillment you gain in return is irreplaceable. So in conclusion, I think there are many challenges in providing integrative oncology education, particularly if you're working in the non-profit sector, but there are also many rewards. And sometimes the impact can be career and life-changing. Tailored, evidence-based education of all stakeholders by a diverse, multidisciplinary and multicultural team is really important, because learning from our patients and learning from each other is the way forward. Thank you.
So as yet, we do not have any questions or comments in the chat, but I think what is very striking from all the presentations that we've heard this morning is the incredible diversity that we have with regard to educational courses and programs that are offered internationally. There's diversity with regard to format. Some are online, some are in person, some are on site, some are in the format of a retreat of sorts. There's diversity of participation, of participants. Some are medical students, some are practicing physicians, some are acupuncture practitioners, some are pharmacists. And then there's also diversity of content. And this content is oftentimes very culturally guided. So I was just intrigued by how much diversity we have with regard to the educational programs that have been developed internationally, and some similar challenges. I was very intrigued by the fact that many governments have endorsed and acknowledged the practice of integrative treatments, or what has been referred to as traditional modalities. For example, in the case of the Kenyan government, 1994, coming out and endorsing traditional Kenyan medicine as legitimate, as important. And that acknowledgement has obviously resonated and contributed to the rise of this type of curriculum in Kenya. Question, Eugene.
Hi, so the question for Catherine is that I saw from actually 2 of the educational programs, the one that Iran was developing as well, that experiential experiencing, having the providers experience the modalities seems to be a critical part, because it's half of it. Half of it's education, half of it's self-care, and also benefits the healthcare provider. So would you agree that that would be an essential component for, let's say, a board certification program? It'd be atypical, obviously, but maybe integrative oncology is the place to introduce that.
I don't know if, can you hear my voice?
Wow.
Oh, whoa, how exciting, Iran, I'm speaking to you across the airwaves. That's a great question. And I I think that although there is great value in courses which allow you to learn at your own time with downloadable resources, I think many of the integrative oncology training programs that I'm aware of do include an experiential component. And I think there is something particularly around the experiences of people who are on a conventional medical training, who just sometimes the difficulty in understanding how these things work is a real barrier to them engaging. But when they actually experience it for themselves, and we've had students who've actually had a massage or had a reflexology session for the first time or experienced healing themselves, as well as watching patients experiencing these things and talking to the patients about the benefits that they're experiencing. So I would say that I love the idea of integrative oncology breaking some of the educational paradigms and breaking away from, just the multiple choice question as a way of assessing, but maybe actually including some more reflective work like Catherine and Johanna's work did, but also an ability to really experience these things firsthand. So I think that's a great suggestion, and it would be lovely to think that we could encourage that strongly as part of any training program.
Just to say that, thank you, Catherine. Just to apologize that we couldn't upload the lecture of Ramanoir from India, and we hope to incorporate his insights in one of our next webinars. So, Victor, did you want to ask a question? And if you are willing to go up so the people on the online media could hear you.
So great presentation, and thank you all for organizing it. One thing that occurred to me was the education committee ought to have maybe a catalog of these various offerings. The Swedish ones, for example, look at the amazing amount of material that we wouldn't have to recreate. So people at different levels, whether it's medical students or nursing students or healthcare professionals, could tap into that and build that into their portfolio, their syllabi.
Yeah. Victor, so I think that this workshop is proceeding before Claudia Witt's presentation, who would provide us with a more comprehensive insight, and that's why we gather at this early morning, so we can prepare ourselves into that important keynote speaker. But for sure, we would like to collaborate with the research committee and the global task force, and to put everything in, and not to recreate, the universe. There's a lot of materials.
First of all, hi, Catherine. Great to hear you this morning. My name is Naisha Winters, and I'm a naturopathic oncologist. And we have been doing these trainings in the US in integrative oncology very successfully and globally. We have 120 physicians who've come through our training across the world. We want more. We have 30 in our program now. We do 2 a year. And to that question about how it interacts, we started more didactic. And then we learned from that feedback that people wanted more interactions. We moved to these live case calls twice a month. And then our final exam is a case study. And we're also doing our first, because of the demand, we're doing our first in-person retreat in February. So I love that these conversations are coming up, that we want that didactic information, but we also want to connect with each other. And so what we're also doing, and hearing this and getting super excited today, is we're building out that directory of amazing programs like this all over. We aren't the only show in town. We don't want to be. We have to change this narrative together. I love that moving together is much further concept. And so there's a lot happening in this area already. And I'd love to engage, find a way to communicate with this community so we can not recreate wheels all over the place. So thank you. Thank you.
Thank you very much. So it might be, when I'm listening to you, it might be a good idea. I mean, first of all, apologize that I'm apologizing that it's a selected group of lectures, and there is a lot of other materials. For example, in Artoi, in Italy, of education, and all over Europe, and we have to be very selective in this workshop. And an idea that just came to my mind, you know, Ashwin, maybe one of the products of this workshop should be a review that we may write together and put all this wisdom together on behalf of the SIO, maybe collaborate with the research committee as well and write it together like a project of the SIO, presenting the variety of different integrative oncology education initiatives from medical school to onward, yeah. And maybe different papers for nurses, for physicians, for healthcare practitioners, because there's a lot on the table, a lot, really. This is only a taster of what it is all over the world, and of course in North America. This is international, so we didn't go into different programs in the US and Canada, but there is a lot in Brazil, many other countries.
I think it's a great idea, and I'm delighted to help and participate in any way I can. You know, I think that, you know, kind of going back to the experiential piece, and really one common thread is, you know, for example, in our program, we use the Arizona Integrated Medicine and Residency curriculum, which is about a 200-hour curriculum that really gives a broad overview of not oncology specific, but very broad-based integrative practice within residency. In internal medicine, we offer it to internal medicine residents, physical medicine and rehabilitation residents, pediatric residents, and now neurology residents. So we have quite a diversity with regard to which GME program that we're offering this curriculum to. And one common thread in all of these areas is the experiential component, and really practicing self-care and wellness and imbibing the benefits of these modalities for our own health. And in the context of the burnout epidemic that has kind of dovetailed from the COVID-19 pandemic. So I think that in this context, you know, when we experience these modalities for ourselves, we can, with greater authenticity and sincerity, teach them to our trainees and also communicate their value to our patients. Thank you to all of our online participants. We are concluding the session. Please do continue to contribute via the chat function. Thank you so much for your participation.